Hi everyone. So starting with what are the currently new and emerging treatments for AML? So I've separated into four kind of main categories, starting with chemotherapy. Chemotherapy is still the standard of care for most types of AML. And so current advances in this area are looking at how we can make this treatment more effective, but less toxic for patients. That's particularly important for older patients, where they might not be able to tolerate the kind of harsh levels of side effects that this current treatment could bring. Another issue is that leukemia cells can become resistant to chemotherapy over time. And so a potential way to counteract that is to combine chemotherapy with different types of drugs to make it more effective. And then moving on to stem cell transplants. The research in this area is looking into increasing the effectiveness and also the safety of stem cell transplants, trying to reduce the risks of adverse effects. And as an example, we have the Amadeus study, which is looking into post-transplant maintenance. And this is trying to increase safety and reduce the risks of any complications of having a stem cell transplant. Next, we have targeted therapy. Excuse me. This, for example, is things like gene inhibitors that target specific gene mutations. And we also have some research I was reading about recently into blocking specific enzymes that will destroy proteins that might be useful to have a increased amount of these proteins to help prevent AML. And then we have immunotherapy. This is boosting the body's own immune system to help it fight cancer cells. This could be through methods such as attaching antibodies to leukemia cells and immune cells, and then bringing those cells together so that the immune cell can fight the cancerous cell. It could be by marking specific leukemia cells and bringing in a toxin that directly attacks those marked cells, or it could be by turning on or off specific immune cells. One particular type of immunotherapy is CAR T-cell therapy. This is known to work in other kinds of blood cancer, and at the moment, research is into looking at if this will work for AML as well. Next slide, please. And then with all these different types of therapies, recent clinical trials are looking at combinations of these types of chemotherapy. So, for example, the clinical trial that I was involved on was a combination of a chemotherapy drug and an immunotherapy drug. And this allowed me to have a dose level that was effective, but without having the unwanted side effects that higher dose level would otherwise have caused. So this is kind of an effective way to increase effectiveness of treatments, but by reducing the unwanted side effects. So what are our patients' expectations of new treatments? So first I wanted to ask all of you what your expectations of new treatment would be. So if you've ever been offered a new or novel agent in a clinical trial, what were your expectations? Or otherwise, what do you think your expectations would be if you were offered a new treatment? Does anyone have any thoughts?
Well, Lizzie, I
Yeah.
guess since I've been through this, I don't know that my expectations would be the same today, but my story is pretty simple. I had AML and I got Dr. Robos. I got the local people to put me in chemo, the Dr. Robos to put me in chemo, and then the last minute we tried a targeted mutation specific thing. My expectations for about a month and a half were zero, because as the story goes, the local doctor said, go home and get your affairs in order. And I was expecting about a 10-month lifespan with transfusions and regular chemo. And when I was offered a clinical trial, it was just that simple. Which choice did I want? Something I had no idea would work, or something that I knew would work poorly. So that was eight years ago. And so the expectations were very, very low. And it was a long, hard grind. And I don't know what today, I think 10 years later, with all the new advancements and all the new opportunities and the kinds of treatments you talk about, I'm just guessing that a patient now, and I know I have a friend whose grandson at 16 is going through this right now for 2 years. I'm hoping the expectations would be a lot higher for survival and quality of life.
Give me that.
Okay, thanks, Ralph. Does anybody else have any thoughts on what expectations would be? If you can click to the next slide, there's a few suggestions there. So as a patient could feel uncertainty, uncertainty of the unknown. Will this treatment be good for me or not? They could be hopeful. They could be fearful of what will happen to them during the treatment, if it will bring any unwanted side effects. And all these expectations can be realistic expectations, or they can be unrealistic expectations. As an example, for my treatment, I definitely felt hopeful that it would help me in some way, but at the same time, my expectations were realistic because my doctor did a very good job of setting expectations when explaining the study to me and explaining that it wasn't intended to be a kind of curative treatment. So hopeful but realistic, I think I would say, for my personal experience. Next, please. So new treatment options are first investigated in early phase clinical trials. And these patients in these types of trials are likely to be people that have already gone through treatments previously, and they haven't been successful. But there are also some patients who can elect to participate in clinical trials with new treatments as their first line of treatment. So we can expect that the expectations from these different patient groups would be pretty different. So how can healthcare providers help to manage patient expectations? So first, they can provide the patient with all the relevant facts, make sure that the patient's expectations are based on these facts, find out what the patient's expectations are already, find out if the patient is thinking realistically about what the treatment could provide for them. We need to have a well-written patient information sheet that describes everything the patient is going to be going through during the treatment, and it needs to be understandable by any person without kind of background of medical knowledge. And there needs to be a path for patients to be able to ask questions and get some answers to help them with their expectations. Does anybody have any other suggestions that they think how doctors and healthcare providers could help to manage the patient's expectations?
I hate to speak too much, but I just want to add one thing to that bullet. And I think it's critical for us all to remember this, that when a patient is in a clinical trial, there are two people in the trial. You wouldn't be in a clinical trial if the doctor knew what the outcome was going to be. So I think we need to empathize with the healthcare professional. Doing all these things is great, but there's no guarantee. And actually, Dr. Robos told me that the many months that I came in, she didn't know what to expect. So let's remember how hard it is on them also.
Oh, that's a good point. Anything else from anybody else? If not, we can move on to the next slide. So what challenges do patients face with new treatments? The first challenge that they face is deciding, do they want to take part in this clinical trial? Do they want to have this new treatment in the first place? So here's a few of the things that a patient might be thinking about when they're considering taking part in a clinical trial. Is this treatment recommended by my doctor? Is this treatment going to be the best option for me? If you have a choice, is this treatment going to be better than the standard treatment options, or should I choose that instead? Is this my only option? Is this the only possible treatment that's available to me? Do I want to start a new treatment if I don't think it's going to be a benefit to me? How is this treatment going to affect my quality of life and day-to-day activities? And is it going to be feasible for me to physically receive this treatment, or will distance to hospital appointments or cost of travel mean that it's not going to be feasible for me to join this clinical trial? And then on the other side, we have decisions around when to end participation in a clinical trial. This could be for a number of reasons, including if treatment is not working as you hoped or expected. Perhaps the treatment was not intended to be curative, or maybe the treatment is working as expected or even better than expected. But whatever the reason for deciding to end participation, to end your treatment, this is going to be a very difficult decision. It could mean that your treatment hasn't worked. And even if it has worked, because it's a new treatment, it's difficult to know when it would be a safe and appropriate time to end the treatment. Does anybody have any comments on this, on treatment-related decisions?
Yep, I do have a comment.
Yeah.
I learned this after my clinical trial was over. I don't know the numbers now, but the president, the CEO of the clinical trial drug company told me later that only 3% of clinical trials in the United States are the first choice, which is the way of saying 97% are done after other treatments have failed.
Yeah.
So that was an amazing thing, because he thanked me for participating. I didn't need any thanks because I thought he had saved me. So, but do I want to take part in this clinical? This is great stuff, Lizzie. This is great stuff. It's so organized. Yeah, is it the best option for me? I think it really depends on where you are in the AML journey.
Yeah, agreed. For me, it was an easy choice because it was my only option. And so essentially, choice made for me. But yeah, you always have a choice. And these are the things you might be thinking about when you decide on to have treatment or not. Okay, we can go to the next slide. So once you've decided that you want to take part with this new treatment, the next challenges that come are going to be the adverse effects that you'll get as part of your treatment. For new treatments, the adverse effects might not be completely known, but these adverse effects can affect every aspect of a patient's life, whether it's ability to do day-to-day activities, whether they can go to work or not, which will have financial implications, physical effects of being tired all the time, feeling weak and fatigue, mental effects of anxiety, frustration. All these things can impact your quality of life. And we all know that eating well and getting exercise are good ways to stay healthy, but these are particularly difficult things to do when you're receiving cancer treatment. So would anybody be able to share any adverse effects they've experienced, or any helpful methods to manage the impact of those adverse effects? based on these topics or any other topics. I can share from my point of view, the biggest adverse effect for me was fatigue, tiredness, just not being able to do anything. And I mean, I don't know if I had a good way of managing that, because it felt impossible to do any exercise. And I know another common one is loss of appetite, and feeling sick all the time, and so not being able to eat. And my strategy for this was just, if I ever felt hungry or whatever I wanted to eat, just eat that there and then. My nurse told me that it doesn't matter what you eat as long as you eat something. Don't worry about it being particularly nutritious for you at this point. Just make sure you get some food. Anybody else have any experiences to share, or methods they think would help? Okay, we can move on to the next slide. So what might the future of AML treatments look like? It could be additional targeted therapies, newer and safer drugs that reduce the effects, reduce the risk of unwanted side effects, more personalized treatment approaches, having each patient could have a kind of tailored treatment depending on their particular type, subtype, or how their disease presents. Improved transplant protocols that improve safety and reduce the risk of complications, and also reduced frequency and improved management of adverse events. So these are all things that researchers are aiming for future AML patients. Any comments on any of this?
I have a comment on the last one.
Yep.
This is all really good stuff. The last one applies to me now, because in December, my chemo, I get chemo 7 days a month, sort of that mid-level chemo. And Dr. Brobos got a hold of me and said, no, you're not having it 7 days a month anymore. You're having it 5. So one thing I've learned, again, I'm only a patient, but I've learned that in whether it's AML or any other prescription you get, I'm thinking doctors pretty much give you the biggest dose that's permissible, because they want to cure you, whether it's this or that, or, antibiotic.
Keep you in remission.
But I've been fortunate that she took me from 7 days of chemo to 5. So quality of life, I don't go in on Saturday and Sundays anymore. It's minor stuff, but also I find that the adverse effects are slightly less. And I, not only that, the 5 days, but it's also, instead of 4 weeks between them, it's now 7 weeks between them. So, I mean, the risk is what was working, why fool with what was working, but we're taking a chance to cut it down. And I mean, these are good pieces of news.
Yeah, for sure. I remember when I was on my treatment, I wanted to have the highest dose possible, because I had that belief that the highest dose means the best chance of it being effective. But I have learned since then that lower doses can be just as effective, with fewer harsh side effects. So I guess it's finding that right balance is really important. Okay, next slide, please. Yeah, that's just some further information, some links to find more information on AML and AML treatments. And that ends this discussion. Unless anyone has any further questions or comments on anything shared in this so far.
I don't want to talk too much, but I have one more comment, and
Yeah.
that is something you know, Lizzie, and I think everybody knows, but all of these options are dependent on two other things: comorbidities and the patient's age. Obviously, the mutation. There's so many dependencies on whether a clinical trial is available or not for you or for your particular situation.